So, the time is 1 o'clock Swedish time, and I will start just to have a short sentence in Swedish, Mark. Hej och välkomna allihopa. Nu ska vi sända ifrån Stockholmshubben igen. Och jag tänkte välkomna min kollega Mark Wolff som är IoT och healthcare expert. So I'll switch to English. Warm welcome, Mark, my friend. It's nice to have you here back in Sweden, virtually. And it's a pleasure for us today to invite Mark Wolff to give a lecture about what is IoT and how can IoT and sensor be applicable and used in the healthcare and for preventive health. We have talked a lot about cloud during the morning. We have talked about how preventive act can be supported, but we also talked about precision health. And I think sensoring and IoT can also give us a more insight about how can we predict and prevent illnesses. So precision health is more applicable for me instead of precision medicine. More welcome, Mark. Nice to have you here. The stage is yours.
Thank you. Thank you very much, Ulf. And hello, everyone. It is a genuine pleasure for me to present to you today. This is I very much enjoy discussing some of the work that I'm doing around improving healthcare and the application of analytics and technology towards improving healthcare and outcomes. And more importantly today, how we can take advantage of sensors, remote monitoring, and IoT. So with that, let me begin and share my screen. And hopefully you will be able to see my presentation. How about now?
Excellent. Yeah, excellent. Yes, we can.
Okay, good. So although I don't speak Swedish, I have a couple other languages, but unfortunately Swedish is not one of them. So thank you for indulging me in English. But we will talk about both the opportunities and the challenges of how the Internet of Things and how sensor technology can aid in improving health broadly, but also improving value-based care, which I'll talk about in a minute. So with that, let me begin with a quote from one of my absolute favorite authors, Sir Arthur Conan Doyle. And this is from a Sherlock Holmes story entitled Sign of the Four. And Sherlock says to Watson about his ability to predict human behavior. He says to Watson, while the individual is unique and a puzzle, and he says insoluble, a puzzle we can't figure out, he then goes on to say that in the aggregate, he becomes a mathematical certainty. That is that as we bring more and more and more data about people together, we create more and more certainty about some insight or some prediction about their behavior. Now, this is interesting, but it begs the question, how? How do we do this? And I would go and take the liberty of perhaps editing Sir Arthur Conan Doyle's comment from the mouth of Sherlock Holmes and say, although yes, as individuals, we are incredibly difficult to understand and predict behavior and indeed predict our state of health, once we start to connect each other, that is to connect the data, the parameters, the telemetry, the information around our behavior and our physiology, then we can make better and better predictions about what cause and effect exists and what can happen in the future given a set of circumstances today. And one of the challenges has been that we have not been connected, our data have not been connected, and more importantly, data have not been collected from our physiologies in a more continuous fashion. So as we take advantage of IoT technology, as we take advantage of sensors, and we start connecting ourselves to each other through our data, we will be in an opportunity to make better and better predictions. Now, given that, let me give you a brief history of technology. And I use the word absurd because it is perhaps a little absurd, but at the end, I hope you understand what I'm trying to say. So let's begin with fire. I think fire was a tremendous technological invention or discovery, maybe a little of both, and it was indeed revolutionary for humankind. What happened before fire and what happened after fire was completely transformative. It changed the world, it changed history. Now, agriculture, another major event. I would not argue agriculture was a revolution, it was an evolution. In essence, we went from looking for and chasing our food to basically having our food in one place. And whether that be crops or whether that be animals, we stopped chasing them. And in a sense, then it was evolutionary. Now, the Industrial Revolution, another important moment in human history. Well, I wouldn't call it a revolution. I would call it an evolution. Because here's an example. We went from digging a hole, let's say with our hands, to digging a hole with a shovel, to digging a hole with a steam shovel. We're still digging a hole. We just changed the scale of what we were doing. So I would argue that Industrial Revolution was really an industrial evolution. And of course, another great milestone, the Information Revolution. Well, I would also argue it wasn't a revolution, it was an evolution. Why? Well, we put knowledge into books. That was an important advance. We then put all those books in a library where you could go and look and read and learn from those books. And from the perspective of an information revolution, well, we didn't revolutionize it. We evolutionized it to that. Now that information was digital, it was available from anywhere, and it was available to anyone with the right technology. It was really evolutionary. But I would argue that what is going on today with the Internet of Things, and I will get to the definition very pedantically of what it is and how we arrive here, that is revolutionary. I absolutely believe that our world will change as we implement more and more connectivity, as we implement more and more sensors, more continuous data, and how we approach those data, what we learn from those data, and how the Internet of Things and analytics will literally transform this world. And I don't believe that's an exaggeration. So let me begin that argument, and let me help you understand what I mean by that. Now, we all know what the Internet of Things is. Really, it is about objects, everyday objects, being connected in terms of their ability to share information and to do that over a network. Very much like many systems today that we have, we've now expanded that to where a factory can talk to a car, can talk to your home. And indeed, examples such as Tesla and other companies, they exist precisely because of the Internet of Things. And we'll get to that in a moment. Now, the Internet of Things in and of itself has driven a revolution or an evolution really in industry. And we went from, like I said, moving from a shovel that we dig with a hand to now a digging machine that can be automatic and managed remotely. That is sort of this path from where industry took advantage of connectivity and sensors and moved up from a dumb device to an intelligent device, then to that device being part of an intelligent system, and then that system being automated and being driven by intelligent autonomous decision making. This occurs today. This occurs today in factories. This occurs today in many other industrial situations. But how can then we take this evolution, this progress made in terms of intelligent devices, systems, and decision making, and move it towards health, and move it towards improving our well-being, and towards improving the outcomes that we expect from our healthcare systems? Well, that's going to take something very important, and that is this concept of edge analytics. Edge analytics being that sensors can actually perform decisions. decision making at the point of the sensor. So it is not only now some sensor monitoring a process, transmitting telemetry, let's say to the cloud, where some analysis is done, some decision is made, and then it goes back to the sensor. Today, we have the opportunity for the sensors themselves to have compute environments, very powerful compute environments, and to actually execute score code or models and algorithms at the point of the sensors and make decisions. And now we can connect these autonomous and semi-autonomous sensors to now inform each other about what they're doing to improve and optimize decision making. And more importantly, edge analytics will be critical because we cannot possibly collect, we cannot possibly store and act on all the possible data that will be available to the Internet of Things. So that actually necessitates new forms of architecture in terms of networks. It necessitates new forms of analysis, which we'll discuss in some detail in a moment, in order to act on data, and in some cases where we don't even collect, store, and use those data in a centralized manner, rather we use it at the edge. So in a sense, we're talking about computing occurring everywhere. Now that we understand a little bit about what I mean by IoT, now that we understand more about edge, what then is the Internet of Medical Things? Well, really, it's an extension of IoT proper. That is, it's the applications and hardwares that are connected to form a system, and that system includes connected people, connected environments, and machines, and we transfer data between them. And the transfer of those data is meant to support really a transformation in how we understand data coming from an individual vis-a-vis clinical decision making and optimizing their health and well-being, monitoring them more continuously. It's ironic that the only time we are measured as patients is when we're sick, because then we go to a clinician to be assessed. Well, wouldn't it be wonderful and important to be measured when we're not sick, so we know what to compare? What is nominal and normal for us, and what is not nominal and normal? And then how do we act upon that? And again, I'll talk about that in some detail in a moment. So the Internet of Things is doing several important transformative functions. We have digitization, the idea that we are moving from analog to digital. That is, from paper to digital systems. We've done that in healthcare, electronic health systems, of course, now transfer paper to digital, but they don't really fully appreciate the analytic aspects of simply moving from paper to digital. Now we need to take advantage of those digital data that are trapped in these electronic health records, and we need to do that through what's called digitalization. That is using technology, and IoT in particular, to change business models, to create new capabilities that produce value. And these new capabilities, these digital workflows, not just going from paper to digital, but now workflows becoming digitized, they now offer us automation and algorithmic decision making, which creates efficiencies and which creates the ability to apply analysis at levels that it could not be applied before. Now, how do we do this? We do this because we now have access to, through IoT and sensing technology, real-time data, high resolution and high frequency data, meaning we collect more data points per unit time, and now we make that data available. And it previously has not been available for analysis, for learning, and more importantly, decision making. And notice I say by humans and machines. And that is very, very, very important. So let's address now a paradox. A paradox that answers, interestingly enough, questions that at least I've always had around IoT, around artificial intelligence, around prediction, and around technology itself, the core of technology. So IoT will actually give rise to artificial intelligence. Now, artificial intelligence is a term coined in the early 50s at Dartmouth College, I believe, where a group of people met. They coined the term artificial intelligence, and they had a summer program where they were trying to understand how computers can replicate the human mind in terms of intelligence, thinking, and decision making. They figured they could be done in a couple months. Now, that term AI has come and gone in history for decades. All of a sudden, it has made a resurgence. We are now talking AI everywhere, and we weren't a few years ago. Why? It is precisely because of the maturity of IoT, because IoT finally will provide the amounts and the frequency of data necessary to drive AI algorithms. And AI has come to sort of a new role in our technological history precisely because of IoT making data available. Now, what's also kind of interesting, and here's the paradox, is that IoT won't work without AI. It needs AI. It's sort of a chicken and the egg problem, isn't it? Why? The amount of data that now is available is so huge, and its frequency and dimensionality so great, we as humans can't manage it without the need of AI. So interestingly enough, each needs each other, and because they are together at this point in time mature, we now talk about IoT and AI and the value that it will bring. Whereas just some years ago, we were really not discussing this. And edge, this idea of compute at the point of the sensor, that is precisely where AI will be most valuable for IoT. Now, that paradox, that relationship between AI and IoT can be seen today. The computational power of new machine learning and AI and edge analytics have overcome so many limitations, tremendous limitations, often what were called knowledge bottlenecks. The idea that we couldn't react fast enough, or we couldn't have a system that learned fast enough in order to do high confidence decision making. And that automation and intelligent decision support actually creates learning machines. And here you can see evidence, proof that my argument about AI and IoT transforming technology and making things possible that were not possible just a few years ago. Now, also ironically enough, those two pictures represent the work of basically the same company, and that's kind of not accidental. What you see here is adaptive learning systems that provide guidance for cars and self-driving, and at the same time you extrapolate that and you see basically autonomous spaceflight, with the rockets not only managing everything themselves, but also landing themselves, which again was not possible some years ago. So in essence, I present this as evidence that analytics, mathematics, combined with IoT and the ability to quickly create systems that learn and respond is transforming our world. And that is why it may be as transformative as fire. Now, a little bit more detail here around clinicians, medicine, and healthcare. It is interesting that clinicians and doctors have a reputation for being very, very early adopters of technology. Interestingly enough, they were some of the first people to use early telephone exchanges in the 1870s, because clinicians immediately realized that the telephone provided them greater access to their patients and faster access to their patients to potentially ask what happened, what is going on, and in turn provide some advice. Whereas before, they literally had to travel to that person. And in that same context, they were some of the first people to adopt automobiles. Here's a quote, and I'm going to read this quote because I think it's important, from the American Medical Association in 1906. Quote, "To no class is the development of the automobile more importance than to physicians. how to reach their patients in the quickest, surest, easiest, and cheapest manner. This is amazing, ladies and gentlemen, because when we talk about value-based care, value outcome over cost, here we are 1906, and we're talking about value-based care and the role that the automobile plays. And they go on to say manner is a practical problem to them. So the automobile and the telephone, the earliest adopters were clinicians because of the value that that technology provided their patients in terms of outcomes. A little bit more history though. So what happened to that thought? What happened to this idea of clinicians adopting technology? Why is the broader healthcare industry possibly the most primitive when it comes to technology, not technology in terms of amazing scanners and medical devices, but in terms of technology where analytics is applied to support decision making? Here's a paper published around trying to understand the reasoning foundations of medical diagnosis. So Science Magazine is trying to understand how people diagnose disease. And this paper had three key conclusions: that there is increasing interest in the use of electronic computers as an aid to medical diagnosis, that there is concern that computers may take over physicians' duties, and that we absolutely believe that the ability to make a more precise diagnosis and a more scientific determination of the treatment plan is valuable. 1959. These three claims were made in 1959, and I would argue that not much has changed. The medical world still believes that computers should be aiding us in diagnostic and therapeutic processes, but there is still concern somehow to let them do that somehow humans will lose some control. Now, another terrific article. This is Dr. Shortliffe actually was one of the first people to create an intelligent clinical decision support system called MySyn in the 70s. In 1987, he wrote, "Computer programs to assist medical decision making have long been anticipated by physicians. Slow progress has been made, and we understand that trained practitioners who must retain ultimate responsibility for determining diagnostic and strategy." There is still concern in 1987 that we're not using computers enough to aid in medicine, yet we're still afraid somehow to give them some level of autonomous decision making. And here, one more bit of history to put context on all this. If models based on patient tumor and treatment characteristics already outperform the doctors, these researchers make the claim that it is unethical not to use models. Not inefficient, not cost effective, unethical. Why? Because we know we can do better and we're not. And this was now nearly going on a decade since that comment was made. Where are we today then? 2021. You've seen that over decades, since the 50s, we've wanted machines and computers to aid in the diagnostic process and aid in decision-making for therapy. And we have not really achieved that. Today, everything is different. The global health outlook looks to technology, looks to wearables and sensors, looks to devices, looks to more data collected over more time to solve many of the challenges that we've had over the decades. Improved access to care, improved patient satisfaction, convenience for patients. How is technology going to address these issues? I may use a strange analogy. Many of us were afraid to do online shopping and online banking. I'm old enough to remember people literally being afraid to give their, let's say, credit card number online or to bank online. We would never go back to that world. The level of convenience and the level of security, frankly, over having to walk around with money, go to the bank, we will never go back. I believe that from a healthcare perspective, convenience, security, more access to clinicians will actually be facilitated by IoT, will be facilitated by connectivity. And just like in the financial world, we will allow some level of automation, and the hard stuff, the difficult things, the human things will be left to the humans, and the humans will have more time for that. We still see bankers, we still see financial people, but we do it for the important and the complex things. The trivial things can be left to machines. Now, that slide was pre-COVID. What about COVID? What about today? And here's an article recently published by Deloitte on the global healthcare outlook. And the first sentence of that report, that the pandemic is placing enormous strain on the global healthcare, on the workforce, on the infrastructure, the supply chain, and it's also exposing something that we discuss, but now we have to address: inequities in healthcare, the uneven distribution of quality care. And this is a global problem. This is occurring everywhere. And at the same time, COVID is exposing these issues, but it's also accelerating change and is creating change by force. And it is forcing us to use computers. It is forcing us to use technology to address the issues of infrastructure, workforce, supply chain. And interestingly enough, technology, remote monitoring, and sensors have the ability to provide more equitable care, in that more people will have access to experts and quality diagnostics. And that is across the spectrum. It is really creating digital transformations. It's finally addressing complex issues of interoperability. It's addressing new care models, remote care, telecare, remote monitoring. It's changing the needs for how we work, whether remotely or with technology, using a computer-aided clinical decision support. And it's actually changing the experience of us with doctors, with hospitals, with clinicians. And it's causing collaborations between health and technology like we've never seen before. So, Internet of Medical Things. Here's an interesting exercise. I Googled the term Internet of Medical Things about 12 months ago, and I received 1,110,000,000 results. I did the same thing 12 months later, and I got 5,800,000,000 results. Within 12 months, in the midst of this pandemic, the concept of the Internet of Medical Things went from 1.1 billion hits in Google to 5 billion hits. There is tremendous interest, but more importantly, there's tremendous progress being made in terms of how can we use IoT to fight COVID? But more broadly, the spin-off of that. Well, if we're fighting COVID, what else can we do with IoT? How can we create the cognitive Internet of Medical Things? Think about that. A thinking Internet of Medical Things. As I said before, how do we add intelligence? And what is intelligence here? Intelligence is the ability to automate certain decision making. And finally, how will COVID push the creation of smart healthcare? What do we mean by smart healthcare? It does not necessarily mean that we don't have smart people involved in healthcare. What we're talking about smart healthcare is, where can we introduce automation, and where can we act on that 1957 paper where, yes, computers can help not only more quickly identify a diagnosis, but more precisely identify a therapeutic path forward. And no, they won't take over. That's the key. That is a theme that finally is being addressed. And whether unfortunately or fortunately, the pandemic is driving those changes, and I would argue for the better. So we are profoundly connected already. So Sherlock Holmes would already say, well, we are creating an aggregate, sort of the theory of large numbers, where more and more people, whether it's their smartphone, whether it's any number of wearables, whether it's any number of connected devices in your home that are monitoring by video, by sound, by motion, today we are hyper connected. And now we're adding 5G to that. What does that mean? Low latency, high bandwidth communication networks that can take more data, more connectivity. That idea that I presented to you in the beginning, that as we become more connected, as we collect more data, we will have to offload some of the work to the machines. We cannot possibly, as humans, control it all just by managing it from dashboards and from reports. We will have to give up some autonomy for decision making about certain data to technology, and that is a necessity. For example, not only are we hyper-connected at home, here's a scene in a hospital room. And that hospital room and the data that those devices are generating is enriched by data, genetics, genomics, proteomics, metabolomics, behavioral data, social determinants, data that comes from the internet, social media, on and on and on. All of those data now can be brought together with acute clinical data. Now imagine what would happen if we connected everything N ways. How do we deal with that? Because that is a possibility. How do we deal with interoperability, connectivity, streaming data, and how do we not lose the patient in all of that? There is actually a patient right there in the middle of that data noise. And humans simply cannot, for good or bad, manage all this, but it is coming. So, software, of course, that's going to be critical. Just like software controls autonomous airplanes, people forget that a modern commercial airplane does not need pilots. In fact, it flies more efficiently without humans at the controls. Yet we still have two highly trained people sitting in, basically monitoring and doing quality control of that machine, not making decisions at every fraction of a second, but being there to make the important decisions, the ones that the machine cannot make. That is how industry today is working. High degrees of autonomy where humans act as quality control managers for the machines. And every now and then the human has to fly the plane just to keep in practice, but frankly, the machine can do it better. And software is slowly changing how clinicians practice medicine. It's changing how we manage our own health. More and more of us receive more and more information about our health, not just when we visit the doctor, but obviously at home, when we're not at the doctor, when we're measuring ourselves and collecting data. And that will change how we interact with clinicians and clinicians interact with us. And an indication of this is this concept of software as a medical device. The idea proposed in the 50s that software can diagnose conditions, suggest treatments, and inform clinical management took almost, well, frankly, it took more than half a century from the point where we realized it was probably a good idea to the time now that we're actually saying we probably need to do this. And the Internet of Medical Things and software as a medical device will accelerate this. It will accelerate research, it will accelerate development, and it will accelerate transformations in care delivery. Now, just a note about some where these paths converge, where they come together, and the good, and also some of the challenges that come from it. Many of you are familiar with the Stanford study on arrhythmia. So basically what happened was, as you know, when the iWatch got the capability to do ECGs, which, by the way, that technology was approved by the Food and Drug Administration here in the US as an appropriate and clinically valid method of ECG, you had to activate that feature on your iWatch. And activation meant logging into a site and effectively signing informed consent and allowing Apple to collect your data for the purposes of a clinical trial. Now, going back to this theme of connectivity, aggregating people, and knowing something about one from the many, almost 500,000 people participated in this study across all the states in the US for 8 months. So basically, 400,000 people had their heart rhythms monitored nearly continuously across a large geography for almost a year. That is remarkable. That has never happened in clinical research. Since the first formal clinical trial was done in the early 40s, we have never had something like this at scale in such a short period of time. And we learned more about the heart than we probably have ever learned in the heart's behavior at a population level than we ever knew before. And that was possible because of a basically consumer device with a sensitive sensor that had onboard diagnostic edge for determining specific irregular heartbeats, collecting those data, aggregating them, and studying them. I can't understate how important that study was and how it demonstrated the potential of technology at the edge and both now in a centralized location where it was aggregated and studied. So let's talk a little bit now about the challenges. Of course, on the iWatch, if you agreed to turn on that feature, you also agreed to be studied, and you were essentially enrolling in a clinical trial. Now, what happens when all those technologies are available, not just on you as a sensor, but around you? Because there are sensors that can monitor. A wonderful example of a camera in an emergency department in a hospital, in the waiting room. That camera can identify every individual there, record their heart rate, respiration rate, and levels of stress and anxiety, and can alert people in the back to say, here's an individual where their stress levels are rising and maybe they need to be attended to before they even come up and ask for help while they're still sitting in the waiting room. And that's passive assessment. That's being done today. So the question then is, of course, there are issues with privacy and security. I was just talking to somebody that is working in the area of quantum mechanics and quantum physics. And they were saying that as quantum computing technology is being developed, it will be able to break almost any traditional algorithmic cyber key. Security will go away from the traditional method in which we secure data, and we'll actually have to invent new ways to encode data from one point to another. And here is a terrific example also in terms of privacy, security, and anonymity, where if we can collect data at such a resolution that we can identify new digital biomarkers for disease, new indications of therapeutic efficacy, because we have resolution that we previously have not, how then do we deal with anonymization? How do we go from the evolution of this artist's view of a tree, which almost represents a path of anonymization? We can't do much with the figure on the right here. We need to understand how we can maintain resolution, yet somehow understand privacy and security at the same time. And that will take potentially new technologies that don't exist today. So that remains a challenge. Finally, another issue about privacy and security, and technology being a two-edged sword. And I'll give a very specific example. There's a tremendous amount of progress that has been made in what's called human pose estimation. This idea that you can take an image of a person, identify the joints and the bones and the structures, and collect those data of how that person is moving, walking, and what their balance is like. So what that means is we can measure in high resolution, as I've said, and in high frequency human motion in such a way that we can analyze and derive measures we previously could not. We could potentially identify the onset of CNS problems. We could potentially identify the onset of Parkinson's or Alzheimer's, tremors that even the patient may not be aware of, but our technology can measure. And in one sense, for example, pathologies through means that are completely new. But on the other hand, those technologies can be used. I know that there's an example where protesters who are wearing masks to hide their face from being identified were ultimately identified by their gait, how they walked, because your gait is almost like a fingerprint. So using a camera that simply measured how you walk, we could assign a unique identity to you and consistently use that algorithm to find you in a crowd. So here again, technology can create new insights, but at the same time, it offers new possibilities for violating your privacy and your security. So those have to be balanced, and they are challenges. And the better the technology gets, the more challenging it is to deal with the privacy and security issues. Now, finally, getting to the end here. Along that line, as we start to understand things or measure things that we could not before, and as that aids in our understanding of early diagnosis, again, going back to the 50s, how can we use technology to perform better, more accurate diagnosis and to provide better and more accurate treatment recommendations? Biology is profoundly, profoundly complex. And this is why medicine is such a difficult problem in trying to diagnose and treat. And this is why often clinicians don't use emphatic language like, we will do this and expect this. This is why we say, we will try this and see if this happens. That is primarily due to this concept of emergent behaviors. Behaviors that arise from relationships between components. So how does one physiological component relate to the other? How we have compensatory mechanisms that act in ways that are not necessarily predictable. Understanding complex interactions between physiology, pathology, and pharmacology. How do drugs affect the body? And what are the unintended consequences of drugs vis-a-vis pathology, vis-a-vis therapy? Those are primarily around emergent behaviors. The way a snowflake is made is basically unpredictable. But we are now measuring things around the body. We are measuring things environmentally. We are measuring things pharmacologically, biochemically, genetically, genomically, where analysis can provide insight into emergent behaviors. And that is primarily through a transformation of how we do analysis. Traditionally, analysis was data is collected, stored, analyzed, and we get a report. That cannot address emergent and complex behaviors. Now we're adding streaming data from sensors. We still can't address the problem. What we've done is we've changed how we apply analytics. We still collect data, store it, analyze it, and report on it, but now we address data in motion, streaming data. We analyze data as it's coming from the sensor, and we are incorporating that with historical data, which gives us the ability to understand emergent behaviors. And this is a learning system. We can now train, supervise, train, score, and this system learns. This is now where IoT sensors, where analytics all come together to provide capabilities we have not had in the past. And that is around digital health. Here's a EMA description where new forms of analysis and data are described in digital health. Here's the US Food and Drug Administration talks about digital health, completely new forms of analysis and new forms of application in the clinical sciences. And finally, from a digital health perspective, our hope that it will reduce inefficiencies, improve access to care, as I've said, reduce the costs, improve quality, and create more personalized and precision medicine for patients. So, last two slides here. The Internet of Medical Things, analytics, to me, equal better health outcomes. Around the concept of value-based care, it will change how physicians practice. It will transform how we actually do medicine at the sort of, forgive me for saying this, industrial level, and it will truly address value-based care. So, value-based care. I've reimagined this equation to take into account streaming data and time. I've decided not to make it a ratio, but to integrate it. And to integrate it from before birth to death as a function of time. And when I solve this integral, what I get is the Internet of Medical Things. And to finish here, I'm going to maybe scare you a little bit with this slide. The human central nervous system is a wonderful, wonderful system. And it has gone through 4.6 billion years of iterations. And it has developed basically these components. There's a central component, there's a peripheral component, there's an autonomous component, sort of edge, and some things we control, some things we let to be automatic, some things we can override, some things we can't. Now, what is both amazing and frightening is that there's an almost one-to-one relationship with how our technology is developing. That is, that edge computing is just like our reflex system. When I touch a hot stove, I don't have to think about moving my hand away. That we have this intermediate component between the edge and the cloud called the fog, where we have basic transduction of data and communication. That we do have the cloud, the brain, where central data storage occurs and model repositories occur. And we have sensors. We're kind of a walking bag of sensors. What's amazing is that whether by accident or design, our technology today with machine learning, AI, and IoT is literally recapitulating the human nervous system. And when this is occurring, and we see what can come from how we evolved, imagine what can then happen when these technologies come together and mimic our very nervous system. And with that, I apologize, I'm 2 or 3 minutes past my time, but thank you so much for your attention and the opportunity to share this information with you. I'm very grateful.
Thanks a lot, Mark. It's wonderful to listen to you. And as Lars used to say, I learn so much every time. Over to the studio in Gothenburg, Lars and Magnus.
Thank you. You gave us some good insights. We liked your energy a lot here. I would like to pass the questions to my good old friend here, Magnus, that is actually a neurologist, about your last image.
Well, it was quite impressive. And of course, every possibility to measure activity in the nervous system is of great importance. Several assessments of the broader function. Perhaps we don't go into detail of this, but it's very good to of course, as neurologists, one would like to have a online digital EEG going on people to see what happens in the brain when they think and they go and so forth. But that is a little bit further on.
Thank you. I also like, Mark, that you bring up the interesting thing here that we often forget, the connectivity against interoperability. We put a lot of focus on interoperability, but when we start to understand sensor technology, we see that it's the connectivity that is the most important thing there. And as I put in the chat, I think it might be that the sensor technology can help us to find the pieces that we are missing in the puzzle, as you described here. We have been aware about the Apple Heart protocol that was put out there. And I also find it very interesting on how we bring back the power to the citizens to do the decision if they would like to be a part of it. Because then we get a lot of healthy data with us also. And that's what we are coming from the clinical part of the world. We are just interested of the sick data, as I used to say. But we have also a question from Andreas. I don't know if we have Andreas would like to ask the question by himself. We can hook you up, Andreas. We're trying to be a little bit interactive here.
Well, at least we're connected.
Can you see Andreas' questions in the chat?
Yeah, I'm here. Sorry about that.
Yeah.
Yeah.
Perfect.
It was very impressive to hear all these examples of how we can use Internet of Things and for our future. But I was wondering about the ownership of data, because who actually owns and uses the information? Who can bring it together to get the full picture that you are talking about humans? Because there's a lot of global companies and a lot of governments collecting a lot of data, but we in public medicine, we don't have any of this data. We can't access it. We can't use it. So how do we? How can we be part of the we you are talking about?
Yeah, that is a challenging question. For example, in the US, I could go to a clinic, a hospital, my physician, and there are laws and rules, but there is always a debate. If you take my blood pressure, is that mine? Is that my doctor's? Is it the hospital's? Or even, is it the company that made the electronic health record? Everyone makes a claim to own these data for sometimes different purposes. I think that the central problem is that those data are of value both personally and publicly. So from a public health perspective, those data are incredibly important. And from a personal perspective, they're equally important. Now, I often use the analogy of the global financial system to get a sense of where we are going with security, privacy, and I mentioned that we would not go back to a world where we couldn't shop online, bank online. But I would argue that my behavior online in terms of my financial life is as intimate and as private as any of my health data. If you know what I buy, you know whether I drink or smoke, potentially whether I'm doing illegal things, and on and on and on and on. Yet somehow we work through this issue of my shopping behavior. Can it be used against me to market to me better? Can my financial behavior be used to, for example, provide me with information about investments, so on and so on and so on. In the end, I choose, at least here in the US, which people I want to offer me information vis-a-vis my financial life. So the question is, I think I own my healthcare data, and I think I can rent it, lease it, or sell it to other individuals. But from a healthcare perspective, I also have an obligation. What is the value of my data for the greater public good? And so I balance the fact that I believe it's my data and I want access to it. And in the US, I'm getting access to all my data. I now have portals for every medical interaction that sends me my information, and I can collect it. I can add my own wearable data to it, and I can do even my own analysis. But I also have the choice to share that data. I think in the end, it will have to be left to the individual in a legal construct to make decisions as who has rights and who doesn't. And that will be my decision. And I hope and I believe that there will also be an element that the authorities and the public health systems will have rights outside of me to use it for the public good. So I balance my ownership with the responsibility for the public good. I hope that's not idealistic. I hope that's not sort of naive, but I believe it's possible. And I think that's probably the best path forward. Otherwise, we will be fighting, because people understand, forgive me for being so crass here, the money's in the data, not in the hardware. And Google knows this. That's why I don't know if that answers your question, but I think the path forward is we have to take ownership as individuals, as citizens, but we have to understand that we also have an obligation for a greater public good.
Thank you.
Nu förlorar jag ljudet.
And I would just add that given my presentation, there is the open question of potentially extracting information from those data that we couldn't even possibly imagine. So that presents a risk because we now have these capabilities, as I described. So how to manage that risk for extracting information that you couldn't even imagine was extractable, I don't know the answer to that.
Thank you. I lost my sound, so I needed a new earphone here. I think you brought up some very interesting perspectives when we talk about data and we look at the world. And we know that in the US, we look at some perspectives. In the Nordics, we look at some, and in China, we look at some. So it will be a question, whose moral is the most important one? I also think that Andreas brought up this big question on who owns, but who controls, or who has the governance of it. I think we need all these perspectives, and perhaps also who will have the benefits, as you say, as an individual, but if you share something, you will give benefits to others. I think, Ulf, our time is going to an end. You are muted still, Ulf, if you would like to say something.
No, I just want to thank you, Mark, for your time and give us the insights you have to the Nordics and to the Swedish days about laws in the healthcare. Very, very fruitful, and as we already said, it was a fantastic lecture, and thank you very much. Take care.
Thank you. Thank you, Ulf, and thank you to everyone. I'm very grateful for your time and attention, and I wish you a good rest of your conference.
I hope to see you in Sweden soon.
I hope so. I spend a lot of time in the Nordics, and COVID has made me miss my time there even more. So thank you. All right. Bye-bye.